It's Friday, December 10th, coming up on an all-new View.
You may think balding is a guy problem, but female hair loss affects a staggering 40 million women, some as early as age 35. So right now, we are finding out everything about the problem called the dirty little secret of dermatology. Please welcome Dr. Doris Day.
Okay.
Wow.
Why is that a dirty little secret?
Well, you know, there are a few things that I see in my practice that are more devastating than female hair loss. I can see the smartest, most confident, most beautiful woman, and as soon as she starts seeing hair falling out, she falls to pieces. And the numbers will surprise you. Up to 50% of women by age 50, and even higher in African Americans, where 2/3 of women by the age of 50, African American women, have significant hair loss. And it starts earlier in women than it does in men. So even in their early 30s, late 20s, women already notice hair loss.
Is it more devastating to women than to men?
You know, men have choices. They may not like losing their hair, but it certainly doesn't affect their ability to get a job, to get married, to have kids. But women start losing hair, and they don't want to go out. They don't socialize.
Does it affect us the same as far as the hair loss?
Men and women do have different patterns of hair loss. So men will notice a temporal recession, and they'll see the hairline receding and then loss in the crown. Women keep the frontal hairline, and then they lose in the crown. Some have it more focally. Some can lose it very diffusely over the whole crown. But there are different types of hair loss in women. So there's one called telogen effluvium. Now this is not a true hair loss. It's really a hair shedding, where 3 or so months after a stress, the hair goes into a different cycle. And so you may lose up to 40% of your hair. So this is after childbirth or chemo or marriage or divorce or some major stress in your life. But that hair does grow back. The next type is something called alopecia areata. These are round patches of hair loss. It's an autoimmune condition, and we now have a genetic understanding behind this, so we might be able to find treatments for it. And but this should be diagnosed by your dermatologist. Another type of hair loss is called androgenetic alopecia. This is true hair loss, tends to be inherited from either your mother or your father's side, or sometimes both if you're really unlucky. And you see a widening of the part early, and then it kind of goes like the charts that we saw where you lose in the crown area. Then another type that was more common in African American women was traction alopecia, but now with hair extensions and all the different treatments that we do in the hair, it can cause permanent scarring hair loss, and that's really problematic.
Extensions and stuff.
And all the relaxers and different treatments we're doing.
Processing too much.
Yes, processing and pulling, tight ponytails or braids.
But that's temporary, right?
No, over time it becomes.
Oh, really?
Yeah. If you do it enough, it can be permanent and scarring.
Okay, so you brought some clients here, and you got some solutions for us.
Yes. So first I have Sasheen. Sasheen, you look and has a beautiful head of hair, and she's a beautiful woman. So she was at her hairstylist, and he noticed that there was a patch of hair, and I'll show you, of hair that was missing, and he really thought it was a scar, but she knew enough to come in. And fortunately, she can cover it. Now, we've been working on this for about a few months now, and you can see beautiful hair regrowing. So my expectation is her hair will fully recover. And on the other side, I'll show you quickly.
Well,
she had a patch here. This is the autoimmune condition called alopecia areata. She had a patch here, and it's fully grown back. So she will have good recovery.
You never be able to tell with your hair. It's so beautiful and thick. I would never know that.
And the best treatment for this is a little, a little cortisone injection. So you just rub the area.
Does that hurt?
Not yet.
She's doing it. You feel a little pinch, and you just put a little bit in. And the reason why you have to do the injection is because the follicle is very deep, so you have to go right down to the follicle. And she'll do that once a month, and the hair will regrow. So that's really good news.
Oh, okay, so let's move on to your next patient.
Over here?
Straight over here.
And then we have...
How often does that person have to have those injections?
Once a month until it comes back. And managing your stress is really important in terms of helping.
Stress is really a key
Whatever
factor,
you're prone to,
it?
stress is a big factor.
Wow.
Get rid of that man if he's giving you problems.
And Lynn has a lot of public appearances and was really concerned about her hair loss. And she has the androgenetic type, the inherited type, that was getting worse over time. So she came in, and for about a year, we've been doing low-level laser therapy for this. And today I have the Illuma Wave with me, and this is a very nice treatment where it has over 180 diodes. These are low-level lasers that are true laser biostimulation of the follicle. And you sit under it for about 20 minutes at a time, and over 80% of people will have the hair stop falling out, and a significant number will have the hair grow back, thicker, darker, fuller. Her hair had gone gray. She was coloring it lighter, and the new hair is growing in black in her original color.
Does this work on a man?
This works on men as well.
As well as African American women?
Absolutely. great results. And I have some
when you
before and
have
afters
male
for
pattern
you.
baldness, you can use this and it'll grow the hair back?
It depends how far along. The closer you get to having, so it's much easier not to lose the hair than it is to replace it.
Okay.
So sometimes you're doing your friends a favor if you kind of notice a little bit of a pattern, just to sort of have that conversation with them, because there's so much you can do these days.
Now, what does it cost?
It varies in cost depending on how much you're doing, so it goes by time. Typically, it's a few $100s. But you know what I find is that for women who are losing their hair, to not lose your hair, you think about what we spend on coloring.
Yeah. So, now, what about hair transplants?
So hair transplants are another option. We have patients doing home treatments all the time, but for a significant number of women, and the numbers range anywhere from 20 to 70% of women might be good candidates. You know you're a good candidate if you have a significant donor area.
Oh my gosh.
This is showing how you have, you take the follicles from the back, put them in the front. The scalp is numb, you don't feel anything, but that hair will stay and grow for as long as it was determined to, which is years.
That just looks painful.
But it's not painful at all, and it really looks great.
Okay.
So, and then you still have to do the
beautiful.
other treatments in order to maintain your hair overall. So it's really important.
I see.
There's so much to be done.
So it's a commitment, but it's worth it.
We want to keep our hair. It's a big part of who we are.
We validate ourselves by our hair. Yes, I think women would say definitely it's worth it.
I would think that women would be less anxious about it because you can always put a wig on. A
Yeah, but
toupee on a man
doesn't
always
want to
looks
wear.
weird.
Everybody doesn't want to wear a wig.
You know, you go on that blind date, you go home with a wig. It's kind
Yeah,
of.
because believe me, when you get with the guy, you got to take that thing off. It really surprises them. Our thanks to Dr. Day. Her book, Forget the Facelift, is available online and in stores now. For more information, you can check our website. We'll be right back. Hey, girl, you got to pull that off.